Most people with cerebral palsy never get the right lab work done. They get a basic blood panel, maybe a CBC, and then they're told everything looks normal. But here's the problem. Standard blood work isn't designed to look at brain function, inflammation, or the underlying chemistry that's driving the symptoms. That's why we use what I call the brain optimization test kit. This is a specialized panel that looks at things like neuroinflammation markers, mitochondrial function, oxidative stress levels, heavy metal burden, gut-brain axis health, and critical nutrient deficiencies that directly affect how the nervous system performs. We're looking at homocysteine, CoQ10, omega-3 fatty acid levels, B12, D3, magnesium, and specific amino acids that your brain needs to function properly. Standard labs ask, are you alive? These labs ask, how well is your brain actually working and what's getting in the way? When we identify those specific deficiencies and imbalances, we finally have something we can actually work with. That's where real progress begins. Once you have your results, I'd love to help. In my next video, I'll tell you what to expect at our clinic.